represent a topic that's covered on the HESI. And that's for me looking at previous HESIs to see what's been asked. I have no idea what the questions on HESI are, but I know what the topics are. So if you spend the time on that HESI review, you're gonna get out of it what you put into it.
Yeah.
Right? It's literally your study guide. Right? And there's a couple of other topics that I want to add, not to your current assignment, because that's what the rubric is, you're being graded on the current one, but I'm in the process of reviewing HESIs from last term, and which, by the way, the group's last term, the average HESI for the PN community was 82. So
That's
students
good.
did really, really well last term. The highest grades we've had so far. We've been creeping up term by term. Year ago, we started in the mid 70s, and 4 terms later, we're up in decent 80s, 82, 83. So that's good, right? So I may add a few extra topics for you to review based on January terms. It's usually pretty similar, but there's always give and take, right? There's always
Are you going to add
some
those in the
topics that
HESI
drop up.
review?
Pardon me?
Are you going to add those in the HESI review, or are you going to send out an email?
Um, I'll probably add those in the HESI review.
Okay. Okay.
Yeah, yeah, yeah. There's usually a few topics that drop off and a few that are added.
Okay.
Okay. So anyway, so you've got the HESI review next week due, and then right after that, you've got your vulnerable populations assignment, that research project, where you pick the home vulnerable population, your zip code, and you do a research project about that population, and it's submitted in a PowerPoint, and that's all in the guidelines. Okay, so it's busy. The next couple of weeks are busy, and then this weekend I'll send out my week 9 announcement. Will be a roadmap. It will cover all 4 weeks. What do you got going in week 9, week 10, week 11, week 12, and just I know we're going to do the quiz. We'll be fine. We have till 4:30. Just so you know, thinking ahead in week 12, right? Week 12, faculty use as touch base. How did everything go? How was the class? How was your HESI? Okay, we won't be having class on the Friday of week 12 because technically the term is over. So the only other section that I teach is on Mondays. Okay, so you either, to get week 12, week 11 attendance is taking your HESI. Week 12 attendance still counts. All right, so even though we don't have class Friday, you're going to either do one of two things. You're going to have to attend the class on Monday with my other group, or you're going to have to schedule a one-on-one with me to do end of term advising. Okay, so however you want to do that, it's up to you. Most Friday students choose to attend the earlier class in the week. The class is short. It's usually 10 or 15 minutes. It's not a full class, and we just talk about the term, talk about HESI, and that's where I get a lot of information from you guys of what was asked on HESI. Do they ask about this? Do they ask about that? And it helps me prepare or see how well I did preparing you for HESI. Right? So more information on that to come, but just know that week 12, we won't have class on this scheduled time on Friday. You'll have to get going earlier in the week. All right? Does that make sense? But I'll send all that out, a long roadmap email this weekend. It covers all 4 weeks. Okay? All right, let's go ahead and let's get going with the quiz. This is your last quiz. The code is still the same. The access code, it's my last name, MARVEL. I'll put that in the chat for everybody. Okay, so let's see. It is 4:10 now. Why don't we plan on regrouping at 4:30? All right, because it's a time quiz for 15 minutes. So we'll regroup at 4:30. You got to stay on camera for this, as you know. All right, and then we'll go through it. So I'm going to go through and mute myself and mute anybody else that's not muted.
Bring me diapers.
Okay, everybody done? You could come back on camera.
I got some questions.
About the quiz?
Yeah.
Yes. Okay,
Yep.
we're gonna go through it.
Oh man.
Sweet.
Okay, we're gonna go through it. Christina, you there? How'd you do?
Horrible.
Not
Yeah, I did all right, but it's just like I just don't understand. Like I got pages worth of notes and it's just I don't know.
It's the
I don't
worst grade I've gotten in the history of nursing school in a year and a half. I don't know what's not clicking because I have notes too, and I did not do well on that at all.
Yeah, and it's just like I don't like to overstudy or understudy, and I'm not saying that all teachers got to be the same, but it's like since I've been in school, they kind of do like when everybody brought an issue up before about quizzes, like if we can go over it before a class, she started implementing that, and then people were doing better on their quizzes. Like I said, I can't tell you how to, run your class or nothing. I'm just making a suggestion, but it's just like I'm trying to do better on the quizzes, and this is like the first time I haven't did as well on a quiz so far. Like I don't know where I'm going wrong at.
Just this class too. It's just this class.
Yeah, and I mean, I don't know. I mean, I didn't do horrible, but I didn't do what I thought I was gonna do. And I spent, like I said, like whole 6
Hours.
pages worth of notes.
Hours reading.
I think what makes this class different is the fact that we take quizzes on material we are supposed to read ourselves before class. And this is the only class that I've really had to do that. So aside from notes that we've taken, if we're taking notes based off of our own perception, not
Right.
what's right and what's wrong. And we don't know what's right and wrong until after we've already bombed a quiz.
Yeah, and it's just
Yeah,
like
I based
like-
the quizzes. I based the quizzes on your reading, and the whole purpose of quizzes, which is what I went over this in week 1, is to it's about your preparation for class.
I have notes too.
I read all the readings though, just
And
like them, and took all the notes, and I still didn't get a good grade. And I haven't but one quiz in this class, and I read everything for hours today. So I don't understand how I just miss all the information that happens to be on the quiz every time.
Okay. Looking at the quiz grades, there's a lot of people who got 10s. And so if you did well on the quiz, how did you prepare for the quiz? If you could enlighten us.
It was the notes for me.
The
It's
notes.
just the notes.
Yeah, I
Okay.
got some notes too.
Okay.
It was just confusing. You really had to read inside the question like the keywords basically.
Yeah,
Right.
you had to read too much, the same thing over and over in order to get the answers.
Okay. Okay. Well, let's go through the quiz. And pay attention to the questions you missed, and let's go through the rationales behind the quiz. Okay? Okay, can everybody see my screen?
Yes.
Yes.
Okay. So let's go through the first question. And I'm going to try and do some of my content teaching with the questions. Okay, this first question, what does this first question have to do? I mean, we're covering several topics. Okay, what concept is this first question about? Where did that come from?
Smallpox.
It look like symptoms.
Bioterrorism and disaster, right?
Mhm.
Okay. So the school nurse notes several children developing pustular rash in their faces, extremities following several days of fever and malaise. What's the next step the nurse should take? In reviewing your information about bioterrorism and disaster, what are these symptoms of?
Smallpox.
Right. What's the right answer? Smallpox. Right. So the nurse would notify the authorities of a potential smallpox in the school. Okay. Why is B wrong?
Because just because you have the vaccine doesn't mean that you won't get
Exactly.
the virus.
Yep. Why is C wrong?
Because why would you follow up with a pediatrician after the scabs and
Correct.
all of that is healed? They're going to look at you and say, okay, what'd you have?
Right. We need to treat the present, right?
Right.
Not the future, the present. They're having symptoms now. We need to start assessing what might be going on, right?
Correct.
All right. And of course we wouldn't do D because these aren't symptoms of
It's something
lice,
different.
right?
Correct.
Yes.
Okay. Number 2, you need to think back to OB. Oh, by the way, exam 3 is in these quiz questions, very med surg focused. If you looked at a lot of your preparation and your readings for last week and this week, it comes from your med surg book, right?
Yeah.
So the nurse is caring for an immigrant who is pregnant with their first child. There are no vaccination records available. Which vaccine should be prioritized?
Not fair, yeah.
What's the correct answer and why?
Rubella,
Why?
protect mom and baby.
Correct. Do you remember that? And you learned that, Callie, in OB, correct?
I did.
Yeah. I was confused at the beginning, but I put the first one.
Udelka, did you keep rubella as the right answer?
Yeah, I know I keep it, but at the beginning I put varicella and then I changed my answer.
Okay.
Yeah.
The health department nurse is caring for a 16-year-old female with a new diagnosis of gonorrhea. Which education is the nurse going to provide?
The
Call a report any pelvic or abdominal pain with a fever because that's abnormal.
Correct. Correct. Right? And the other 3 answers are wrong.
totally wrong.
They're wrong. Totally wrong. Exactly. And this comes from your STD readings from this week. The occupational health nurse is caring for a client who just sustained a needle stick injury at work. Which education does a nurse provide regarding HIV testing?
You
That I
want
need
them
to come
to-
back in 3 months to repeat
3 months.
it.
Why is that the correct answer? What's the rationale behind that?
Because the first one can be negative
Up to
up to 3 months or
up to
3
12
to 6
weeks.
months. Yeah.
Right? Up to 12 weeks, you can have it may not be detected.
I have a question on that.
Uh-huh.
So I have the right answer, return for another HIV test in 3
Mhm.
months to determine exposure. But after the 3 months, do you test again?
Not necessarily, no,
No.
unless you're symptomatic. Continue to
Okay.
be symptomatic. But the
I thought you
guideline
tested
is to
3
read
months, and then I thought you tested again after the 3 months.
unless you're symptomatic.
Okay, thank you.
Okay, so that comes from your readings. This question comes from your readings with regard to HIV.
Yes.
I mean, I try and develop the quizzes from your readings. The nurse is developing a primary prevention for tuberculosis. Which intervention is appropriate? Think primary. What do you try and do on the front end to prevent something? What's the right answer?
Reduce.
To reduce.
It's to
Reduce
reduce.
crowded living. A
I
lot of
second
people,
guessed myself.
yeah, a lot of students select A. What is A?
Teaching residents of a homeless shelter.
Right, but what is that?
Secondary prevention.
Secondary, because
Like
you're
screening.
screening,
Yeah.
right? We know that homeless shelter clients are at risk, right? So what we're doing with A is we're screening. What's B? Primary, secondary, or tertiary?
Tertiary.
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 Third, yeah.
Tertiary, because they're already
They
being
already
treated
have
for
it.
something, right?
Yeah.
And the last one's screening as well.
Exactly.
Yeah.
The home health nurse is visiting a client recovering from a right hip replacement 8 days ago. The client is complaining of calf pain in the left leg. Which intervention is a priority? Before we answer that, there's a lot of information that you need out of this question, correct? This is a
Yeah,
client who
was-
had surgery. It's been 8 days ago. You need to think med surg here. what they're complaining of, calf pain in the left leg, and what is a priority.
The
So what are we
pain.
thinking here? What are these the symptoms of?
You're thinking of, you would think it's A, but like you said, the priority, like they're complaining of pain, and then it's like how long it's been.
Right?
I thought
Symptoms of a
infection.
DVT.
Exactly. That's what this question is making you think about. What are these the symptoms of? Post-surgery, 8 days, priority. You've got calf pain in the left leg. We've got
So
to be thinking
DVT?
about DVT or blood clot.
Yeah.
Right? And
I
the
was not thinking
question,
DVT. I was thinking infection.
right? You need to think DVT here. Right?
Yeah.
Well, especially if you look at he had right hip.
Mm-hmm.
It's
Okay.
another one I second guessed myself on number 6. I
Stop
was going
doing
back and
that.
forth.
Stop
Oh,
doing
yeah,
that.
me too. I get stuck in that one.
Stop doing that.
I wish it was that easy
I know.
to just
Well,
stop.
I second guessed myself on number 4. I kept going back. I was gonna pick C and I didn't. I'm mad about
Kicking yourself. Yeah. The ones I got wrong, I did the same thing. And I'm like, why'd I do that?
don't second guess yourself. If you come across the right answer or come across an answer right off the bat that looks to be the correct answer, stick with that. Okay, now we're talking about some complex chronic diseases, peripheral artery disease. So the home health nurse is caring for a client with chronic peripheral artery disease in both legs. What is going to be part of our teaching?
Stop smoking.
smoking.
Stop smoking.
Stop smoking to improve blood flow.
Yeah.
And that question came right from your reading. Okay, so like I said, I developed these questions from the reading ahead of class. So if you're doing the readings, I'm hoping you're doing well on the quizzes. If you're not doing the readings, then
I don't even think, like I said, because I didn't do terrible, but I'm used to making a certain like grade. But anyway, so like for some of them, I didn't know, like some of them was straightforward. And like you said, I'm thinking of it as a community nurse, like in the community. So some of them was straightforward, like community care. I said, so boom, right that. But a lot of them, I was like, okay, I need to know, they might need to, I gotta teach them the signs and symptoms. I'm like, so I'm writing that too. So I just was like, I was just all over the place. That's what I was.
Well, and again, this whole class is the basis of this whole class, all term, is shifting your mindset to caring for somebody with peripheral artery disease in the hospital setting to what is that going to look like in the home? It's different. Which dietary modification should be used by a client with COPD?
Rest.
There's only one right answer here,
See,
Yeah.
right?
and I don't, yeah, because of the breathing, like you don't want to do
Exactly.
much.
Yeah. You need to give him time between meal.
Exactly.
Between
I mean, the other answers are actually incorrect. We would not teach to eat 3 large meals a day. We don't need to teach about limiting non-caffeinated fluids. And we certainly don't educate to remove oxygen while eating. Right? Another complex chronic illness, cirrhosis. The home health nurse is caring for a client with cirrhosis. Which intervention is a priority?
I can guess myself on this.
Priority is the key word. Okay, what's the priority for somebody with
Them not
cirrhosis?
falling, not falling.
Safety, right? It's not that the others are not correct, right? But what's the priority? Safety first. And that's what A is. Then another complex chronic illness, hypertension. Which food should be avoided by the client with poorly controlled hypertension?
And soup because of
The
the
salt
sodium.
and the soup.
Sodium.
The sodium in the soup.
Why are so many people coming back in and out? Is the internet okay?
I tried to send you a message. I got kicked out. That's my whole computer just shut down. I don't know what was wrong. I didn't even get to finish my quiz.
Why don't you stay on after Christina, okay?
Alrighty.
Were you able to submit it?
Yeah, it's submitted what was given. It just the whole thing, the internet just went down. So it's
Your
submitted the full-
internet.
yeah, I'm guessing so, but I've never had this problem in the last 8 weeks.
Okay. Okay, everybody got the PowerPoints for week 7 and week 8. Can you see my screen?
Yes.
Okay. So let's do this is a long one. I'm going to go through this really, really quickly, and I have some notes. We talked about, let's see, where are we? Infectious disease prevention and control, HIV, TB, STDs, bioterrorism, and disaster. Okay. Let's discuss the epidemiological triangle. As you prepared and read about this, what did you learn? What is the epidemiological triangle? It consists of 3 areas. What are they?
Host, agent, environments.
Yeah. The agent, the host, and the environment. Okay. What is the agent?
The disease.
The
causing
disease.
The micro.
Go ahead.
Yeah, the disease causing the micro.
Right.
I don't know how to say that.
Is it a virus? Is it a bacteria? Is it a fungus? Is it a chemical? An agent. Okay, you're going to get asked about the epidemiological triangle in the next exam. I think there's a few questions about it. You have to understand it. So the agent is whatever maybe it's influenza. Maybe it's COVID. Maybe it's sepsis, strep. Okay, what is the agent? Okay. The host is us. Who that agent is infecting, who that COVID, let's just use COVID for purposes of this discussion. COVID is the agent, it's infecting us. We are the hosts, a living organism. Okay, so, and then I'll talk about the 3 together. The environment is what environment you're in. How does the environment affect the agent and the host? Okay, so let's think about COVID for a minute. Let's say the agent was COVID, you were elderly, and you were in a nursing home. Were you at much higher risk than the younger student in the classroom exposed to COVID?
Yes.
Okay, so the environment and the host and the agent are all interrelated. Think about flu. Let's say we had the flu. Maybe the host got the vaccine, the flu vaccine. So maybe they're gonna be affected minimally than somebody that didn't. Does that make sense?
Yes.
Only Udelka saying yes. Does that make sense? Everything is interdependent on each other. Whatever the agent is will affect the host. What kind of factors affect the host? That's us. Maybe age, ethnicity,
Underlying diseases.
Comorbidities, health, general health. And then what kinds of environmental factors may impact the way the agent and the host, how sick they get. What kinds of things in the environment? Well, think about the migrant population living in crowded living conditions. Let's say the agent is TB,
Or
Shelters, homeless.
right? The agent's TB,
with poor
the host,
hygiene,
pardon me,
poor hygiene.
poor hygiene. But let's go back to TB. The agent is TB, the host is the migrant population, and the environment is housing. Does that pose a great risk?
Mhm.
Yeah, of course it does. What's the single most important aspect of medical asepsis and infection control?
Hand wash.
Washing
Washing.
hands.
Yeah,
Hand
hygiene.
washing. Hand washing. Okay, let's talk about the difference between passive immunity, acquired immunity, and herd immunity. Passive, what's passive immunity? What you learn from your readings? What's passive immunity?
From someone to some
Go
from
ahead.
someone to another.
Yes, yes. Okay, what about acquired immunity? We talked a lot about this during COVID. What's acquired immunity?
It's like when you get the what is it? The
Vaccine?
immunization, or when
Yeah.
your body actually goes through the disease.
Right. So they were telling us with COVID that once we got the disease, we would build some immunity to it, right? That's your active immunity. What's herd immunity? They talked a lot about this during COVID as
That's
well.
like where enough people get vaccinated that it protects the people that aren't vaccinated too.
Exactly. Herd immunity. That's exactly right, Rebecca. Okay, let's talk about the difference between vertical and horizontal transmission. What's vertical?
Like the breast milk, mother
Yes.
baby.
Mother or father to a child.
Yep. Yep. And what's horizontal?
Horizontal,
person to person, spreading across.
Yeah.
Right, Cecily?
Yeah.
What is incubation period versus communicable period? What's the difference between those?
The incubation period is like when the organism first enter the body and it lasts until the onset of symptoms, and it's like contagious. And then the can't say that word.
Communicable.
Yeah. I don't know, because I wrote, is that the same thing as the prodromal?
Communicable period, your interval in which the infectious agent may be transferred directly or indirectly to the infected person.
Oh, because I only got incubation, the P, and the illness and covalent.
Nope. Incubation is from the time you're infected till the time your symptoms start showing up.
Yes.
Right?
Yep.
Yeah, I got that one.
Okay. There's differences between epidemic, outbreak, and endemic. What is an epidemic?
Major, like
whatever it is
Epidemic.
has increased above expected levels. So COVID was an epidemic, right? Endemic is something that's not going to go away. It's always going to be there.
It's
Think of the
always
flu.
there.
What?
Yeah.
The flu.
It's always there, like the flu. Yeah.
Yeah. Right. Okay. What's an outbreak?
Something that is spreading like through your community. Or where you
at higher than expected levels. A lot of similarities to epidemic. Okay, couple of questions here. To reduce the incidence of healthcare associated infections, true or false? Use proper hand hygiene before and after caring for a client. True or false?
True.
True.
Before donning gloves and after their removal.
True.
Absolutely. Standard precautions. What are standard precautions?
For everybody.
Everybody.
Yeah. Okay, when do we use airborne precautions?
For TB.
For TB, tuberculosis,
Yeah,
Okay.
Measles, varicella, and you gotta wear the mask.
Yep.
N95.
Yep.
airborne disease.
Exactly. What's the difference of the 3 hepatitises? What's hepatitis A?
A by
Food and water.
fecal transmission.
And
Pardon
that's
me?
the one, I think, if I'm not mistaken, that's the one that's like,
From
it
like,
can kind of be like you can kind of treat it a little bit, like the other ones that they don't never like go away.
Yep. Hepatitis A, fecal oral. Right?
Yeah, fecal.
Who's at high risk for hepatitis A?
I don't know how you say that. Men to men, something like that.
Yes. Yes. Illegal drug users.
Illegal drug use, yeah.
Right? People who have
Travelers.
a comorbidity of, say, a liver disease or some kind of liver disease. Right? Vaccines are available. Right? For those at high risk. What's hepatitis B?
Blood.
Blood.
I think of B,
transmission.
hepatitis B being bloodborne, right?
Yeah.
High risk populations, IV drug users, people with other STDs or multiple sex partners, right? Inmates in correctional facilities, high risk for hepatitis B. Hepatitis C, bloodborne, again, high risk, IV drug abusers. And interestingly, 85% of people who develop Hep C, it turns into a chronic lifelong condition. Okay, let's talk about bioterrorism disaster. How is safe drinking water? How do we determine the water is safe? Can be rendered safe before drinking by boiling what? How long do you have to boil?
30 minutes.
10 minutes.
30.
Pardon me?
3 to 5 minutes.
3 to 5 minutes. Second box, can be rendered safe for drinking by treating with household bleach. How much?
1, I think.
1
1 to 10.
mil,
Per
16
gallon.
drops, right? And how long do you let it stand for?
30 minutes.
30 minutes.
30
yeah.
minutes. Can be rendered safe for drinking by removing water from hot water heaters.
No.
Okay.
So it's boil you for 35 minutes and the bleach sit for 30.
Yep. It is boiling for 3 to 5 minutes, treating with household bleach and letting stand for 30 minutes.
30.
There's a lot of this that we don't really need to go through. I'm going through the highlights. What's the biggest difference between smallpox and chickenpox?
Smallpox, I think
is
it's
sort
on
like
the
in the
swallow,
mouth
but
and
the
stuff.
feet and the arm and the hands.
Arms are the hands and soles are the feet.
That's a smallpox.
Yes, you're not going to see chickenpox there. That's the distinguishing factor. Okay, let's talk about some different agents. Okay, the ones I want you to know about. Anthrax. Take notes on this.
Respiratory.
Okay, anthrax. What does it affect? It affects your skin, your GI, and your respiratory. And that's on your HESI study guide. Another agent is smallpox. Okay. Yes, we talked about soles of the feet and hands, palms of the hands. Smallpox starts like flu-like symptoms, develops into a rash, red spots, and then these pustules actually become so deep that they will leave craters in your skin. That's an identifying factor of smallpox. The other, chickenpox. Talked about chickenpox. Starts with a small rash, small red dots, and they turn into blisters, not craters, blisters. And then the other is sarin. And that's on the screen right now. Sarin, one of the biggest side effects of sarin is extreme respiratory impact. Okay. What do we do with the toxics? What do we do with a toxic chemical spill? How do we remove clothing? What do we use?
Tongs.
Tongs. What do we do with contact lenses?
Remove from away.
Okay. Okay, so part of well, let me go back. Foodborne illness, food safety. For me, I think I've already said this before. When I go to a restaurant or go to a fast food, I have the expectation that people are preparing the food correctly, storing the food correctly, serving the food correctly. But foodborne illness is a real issue in our communities, right? So what do we want to do? Wash hands before and after handling food. Separate that raw cooked food, right? Using separate utensils, separate surfaces. Cooking the food thoroughly, right? Not using food beyond its expiration date. Another area of disaster management we talk about is waterborne illnesses. When water's contaminated, whether it's animal or human fecal contamination. The two most common waterborne illnesses we see are cholera and giardia. And then the other kind of disaster management we talk about, it's called vector-borne illnesses. This is the mosquitoes, the ticks, Lyme disease with the ticks, Zika virus with the mosquitoes, Rocky Mountain spotted fever is another one, right? Those are particularly carried by dog ticks. And then malaria is mosquito related. Okay. We just discussed that. Food, water, vector. Let's see. Oh, a couple of kinds of disasters, natural or man-made. What's a natural disaster? What's it? Some examples of natural disaster.
Something that is not provoked by humans, like a hurricanes,
Hurricane.
By Hurricane Katrina.
earthquakes.
Earthquake. What about man-made disasters? What are some examples of that?
Fires.
Fire. What else?
Some chemicals.
Chemical spills.
Yeah.
Gas bomb explosions, stuff like that.
Yeah. We just went through some examples. There's some pictures of those. When do we use an N95?
TB.
TB.
For TB.
What are some other precautions we might take for clients with TB?
Putting in by himself in the room.
What did you, private room, did you say?
A private room, that's what I'm trying to say.
Right.
Yeah.
Negative pressure or something, I'm not sure.
Negative pressure. Do we let them roam the hallways in their N95 mask?
Only where they needed to go out. And they need to wear a
Absolutely.
mask.
What about visitors? What protection do they need?
The mask.
That's N95. Yeah.
N95.
Okay. This is what's significant about the bite with Lyme disease. What do we call this here?
Bullseye.
Bullseye. Yep. Yep. So that's what I'd like you to know about week 7 content. Okay. Let's go into week 8 content. There's your readings. Okay. So here, home care, community resources, case management, and then the complex illnesses. This all comes from your Med-Surg book. The readings for care of complex chronic illnesses. What is home care? What's the highlight of home care? Where are we delivering the care?
In our homes.
In their homes.
Right. What are the reasons we provide care in the home? Most clients,
They
most clients-
prefer, they prefer to be in their own home, and if they can and have the financial means or something to do that, then they do.
Right. The other factor about home care is it's individualized care.
Oh,
right?
yeah.
It's not group care, it's individualized care.
To maintain their autonomy.
Yeah, maintain, exactly. We're trying to maintain that ethical principle of autonomy, involving the client in their home setting, in their plan of care. Right? One of the purposes of home care is to facilitate self-care. They've been discharged from the hospital, they're in the home, and we want them to help manage whatever's going on, from an accident, a chronic disease, a new diagnosis. We're trying to help them be self-sufficient. The nursing assessment in the home. Why do you think the nursing assessment may take a lot longer in the home than it does, say, in a hospital setting? What's
because
different?
with the home, you gotta make sure the safety.
Yeah.
And
to make sure that everything is safe for that person.
Right. Safety.
When you're in the home, you're doing a whole bunch of different assessments, aren't you?
Yes.
You're doing an environmental assessment, right?
Infection control.
Infection, a safety assessment, a fall risk assessment. You are
assessment, seeing who's around in and out of the home.
Say that again, Kelly.
I said you're doing like a safety, like a support assessment for everybody who's in and out of the home. Like, does the cousin, brother, uncle, whoever, sister, whoever come in and out of the home, is that person on a opiate or like a narcotic drug, or like they're gonna take the drugs or whatever?
Exactly. Right. So my reason for asking this is nursing assessments in the home are very different from nursing assessments in the hospital. You're having to look at the big picture, right? Doing all kinds of assessments, means assessment, safety assessment, support assessment. What supports do they have? Resource assessment. What resources do they have, or what resources do they need? The initial home care assessment is very complex and covers lots and lots of different areas. Okay. What's the difference between Medicare and Medicaid?
One is for like the
Elderly,
like
65 and
elderly.
older.
The other one's like for younger, like adult people.
Not
Medicare. Well, there's one, yes, Medicare is for 65 and older, but what's the other factor that qualifies you for Medicare?
The
income.
Nope.
No, because
income
both
is
of them
Medicaid.
income based.
Medicaid.
And the reason I remember that is aid. At the end of it, it's Medicaid, because I used to get a lot of families in the schools on Medicaid. And I just remember, because I had trouble remembering the difference too. And Medicaid, the word popped out, aid at the end. They need aid. They need financial aid. Okay, so Medicaid is need-based, right?
Medicaid, need-based.
Need-based, aid. I used to aid my families in the schools with Medicaid. That's why I remembered it. Medicare, yes, 65 and older, but also anybody at any age with disabilities. Right? So for example, whoops, I stopped sharing. So sorry about that. For example, my grandson, who's now two, but had two perinatal strokes 2 years ago when he was born. Okay, and required lots of stuff. He had a hemispherectomy last year. Well, about 6 months ago, he went on to Medicaid or Medicare. So now he'll be on Medicare forever. He's 2 years old, but has a significant disability or disabilities. So it's also for disability, 65 and older and disability. Does that make sense?
Yes.
Okay. Community resources. One of our primary functions as community public health nurses is we have to know our resources. When I was in the schools, we all had huge books of resources because every child or every parent or every person you work with in the community, hospice, doesn't matter, occupational health, everybody's going to need different resources. So you have to have a good understanding of what's in your community. All right. So we know what do community resources do. They enhance the self-care capacity as we're moving clients towards independence, taking care of themselves. Right? The more resources we can provide them, the less at risk they are for not being able to be independent. Right? Community resources also help clients manage their complex chronic illnesses. A lot of people with complex chronic illnesses need community resources. Right? And with all these resources that are available, the goal is to reduce vulnerability. Okay, and this is for anybody in the community, including the vulnerable populations. Some examples: nonprofit organizations, volunteer organizations, Meals on Wheels, Red Cross, food banks, clothing banks, domestic violence shelters, teen pregnancy clinics, right? Churches provide a lot of resources, transportation services, dog walking, sitter services. One of the things we all face in our communities now is an increased population of the non-English speaking sector. Would you all agree? If you're the community nurse in that community, what are you going to do to enhance that?
To get more interpreter or to provide schools to learn.
Say that again, Udelka?
Like a schools for learning.
Like an English as a second language?
Yes.
Okay. All right, what else? What other resources can you provide them? Who could you seek out in the community to help you?
Interpreter. Oh, you see the probably how you say that? Another government.
Who could help you out? Who could help you in the community with your non-English speaking clients? Remember, community nursing is all about teamwork.
Whoever else speaks the language of your like interpreters or any other nurses, or I don't even know if that's allowed like in this area. Normally it's an interpreter, but I don't know if it's a little different.
What about religious leaders?
Yeah, the priests.
You know, if it's
for that section there, I don't know how you say that.
Yeah, community leaders, religious leaders who work with these populations. I have a friend who's from a Vietnamese culture that it lives in our Denver community. She always tells me that the church where her community gathers at, this huge Vietnamese church, every Sunday they have like a fair, health fair. People come in and do blood pressure screenings. People come in and do blood sugar screenings. People come in and provide information on, healthy lifestyles, whatever it is. But they always have resources after all the masses or whatever all the services they have in this community, and it's in their primary language.
That's what we have in our clinic as well. We actually have a care coordinator.
Okay.
Because it's because we're getting so many of the Spanish community coming in.
Mm-hmm.
And we actually have a clothing closet for them, and we have a food closet. Mm-hmm. So we actually post up like pieces of paper so about food insecurities, but it's all in Spanish. And then they let us know by the end of their visit, and then we get that coordinator to come over.
Yeah.
And they go down to the food closet and pack their food, get clothes for them and their children.
Yeah, that's fantastic. Fantastic. That's what community resources are all about. Right? So you have to be cognizant of what's available for your different types of clients in your community, whether they're non-English speaking, whether they have a complex chronic illness, whether they have significantly impacted children. Right? There's needs. There's so many needs with so many different parts of the population. Okay. What is case management? What's a case manager?
This meeting is.
What's a case manager?
It's like somebody that assures you get your appointments in on time, and they pretty much do everything.
They're the care coordinator. Another word for what Charlene was just talking about is care coordination. Okay. Again, the primary purpose of case management is you're working with individual clients. And these are usually individual clients with significant needs, comorbidities, lots of things going on. So let's say you have 2 patients that had a triple bypass. Okay, and they're both going home on the same day. But one has a very supportive family, has had visitors all the way through, has all their follow-up appointments scheduled. The family can get them to cardiac rehab appointments. The oxygen company is delivering the oxygen, and they're very well organized. There's a lot of issues going on with the medical necessities of the client, but they have the support systems around them. Versus a client who has no family, has no means of transportation to get to any follow-up appointments, who doesn't have the financial capacity for home equipment or medications. That second patient is a client you would want case managed. Mm-hmm. Right? They need lots of resources. Okay, that first client will be okay. Okay, so they're typically reserved because you'd love to case manage every client, but you can't. So it's the high risk, comorbidities, lots of needs. Let's take somebody that's being discharged from a behavioral health facility that has several mental health diagnoses, and has substance abuse issues. That client's going to need some case management. Okay, just think of all the resources you have to pull together. Okay, think of that for a second cardiac client. They need transportation, they need financial assistance, they need probably aid services to come in and make sure things will do some kind of a home assessment. They may need PT, they may need OT. Somebody maybe who is going home with a stroke that doesn't have any support. They may need speech. Okay, so the big difference with case management, it's implemented with individual clients, typically for high cost chronic diseases, which we talked about, diabetes, COPD, cirrhosis. Case management is labor intensive. There's a lot going on. If you're the case manager, you are the coordinator of all of this. Okay. Um, Oh, okay. I want to go over communication. Case management requires varied type of communications. Please know the difference. You're going to get asked about this, and I'll go through it. Write these words down. Collaborating, cooperation, compromising, and assertiveness. Those are 4 different ways to communicate.
Sorry, what was the last one?
Assertiveness.
Assertiveness.
So you're going to get asked a question about
What was the second one?
collaboration, cooperation, compromising, and assertiveness. You're going to get asked a question about a scenario of people communicating. What is this an example of? And I'm going to go through this in my review in a couple of weeks or next week. Collaborating. You're working with others towards a solution that satisfies both people. You're collaborating. If you're cooperating, you're understanding and meeting the needs of others. You're cooperating. Compromising. You find a mutually accepted compromise or solution that maybe partially satisfies everybody. You're compromising. Right? And then what is assertiveness? Right? You're just talking about your own needs. Okay? And then the rest of this last slide and the rest of my notes go about care of chronic complex illnesses. This is from MedSurg. All right. So we're not going to go through the diagnosis, etiology, but go through your readings and read about each one. These are all also on your HESI. And this is part of the reason why I say that your HESI is somewhat MedSurg focused. It is focused here. Complex chronic illnesses are on your HESI. And I think that all of these, maybe not pelvic arterial, maybe not peripheral artery disease. I think it is though, is on your HESI prep.
Yeah, it is.
Yeah. Okay. Okay. But the one thing I do want to talk about is post-op care, and this was in your reading. Okay. And I know this is kind of MedSurg, but what kinds of risks are we looking for post-surgery, post-procedure? What are we looking for? We talked about, go ahead.
Infection.
Infection.
What I got from it, maintaining the airway too.
Airways.
Complication. Reinforce about the signs and symptoms of complications.
Yep.
Oh, and protecting from injury.
Yep.
And making sure they can perform self-care, and you got to do collaboration with that too, with the patient, providers and stuff.
Assessment for sepsis, assessment for dehydration, right? At risk for urinary tract infections, gotta be watching for that. If they have a wound, how is it healing? What does the skin look like? Any signs of pressure ulcers? What's their pain assessment? What's their pain scale? And then the
Wow, Jason.
medications they're taking, do they have any GI symptoms from that? You talked about preventing complications with your aseptic technique, changing dressings, turning, coughing, deep breathing, and central spirometry. Let's talk about for a minute delegation. This is the last thing I want to cover is delegation. What kinds of clients, kinds of patients could you delegate to your unlicensed personnel?
Somebody that needs to
Stable.
get up and ambulate.
Stable patients. You cannot delegate an unstable patient, correct?
Right.
Okay. Because you're delegating, you need to be very specific on what you're delegating. Let's say you're delegating wound care, change of dressing. Okay. Very specifically, you need to talk about what is the task to be done, how it's to be done, what needs to be documented, and what you expect them to communicate back to you if there are issues. Right? Because remember, with delegation, whoever you're delegating to, they are working under your license.
Still your responsibility.
It is you are responsible for what they do. So you can't just send them on their merry way. Right? You have to be very specific. What's to be done, how to do it, what is documented, what you need to report back to me as far as concerns. Delegation is big, big issue. And you certainly can't delegate unstable patients. Right? So, okay. So we covered a lot. Infectious disease prevention and control, HIV, TB, STDs, bioterrorism disaster. We covered home care, community resources, case management, care of the chronic complex patients. Okay. So I need you to go back and read about your, you need to do the reading in week 8 in your med-surg book. Okay, there's lots of questions on the next exam about those complex chronic illnesses. And it's not full chapters, it's little snippets from each chapter, about each one. Okay? This exam is the most med-surg focused. Okay? Questions? So you've got
have a question.
Yep.
I have a question on the HESI prep assignment.
Mm-hmm.
I know that you have you have things listed, like obesity assessment, lipid screenings, and then you have nursing guidelines. So is there a minimum or maximum you want written in there?
Nope.
And
I want in there what information you need to study for your HESI.
Okay.
That's what I want. So think about the HESI prep is clinical judgment.
Okay.
Anthrax, first box, anthrax. Think about the nursing process. That's in the directions. What might they present with?
Because some of mine are really long, but I don't know if I'm doing it too much.
There's no right.
There's
no right or wrong way to do this. Okay. This is you're building your study guide. So whatever information you need to know about anthrax, you put in there. Right? Okay. What is anthrax? Think clinical. What might a client present with? What are the signs and symptoms? Maybe how do you diagnose it? What do you treat it with? How do you think of you're doing your assessment?
Because some of mine are really, really long, and then some of them are shorter.
That's okay. So I'm like I said, there's no right or wrong way to do this. Okay. This isn't intended to be a a workhorse assignment. This is intended to be started at the beginning of the term and build this up to be your study guide for your HESI, because this is essentially what you will be using this to study for your HESI.
Yeah.
Right. But
I just wanted to make sure that you were like, no, I don't want all this.
No,
like you're not doing
no.
it right.
And you know what? I don't even know that I mean, it is expected that you know what anthrax is. Right? What it's asking, what this is asking you to do is, how would you care for a client with anthrax? How would you care for a client with a below the knee assessment? How would you do an obesity assessment? How would you home care? There's the whole section on home care. And if you look at the categories I've broken it down into, they're concepts we've covered. Now, I may not have covered every single box, but I have covered the concept. And so some of those boxes are going to require you to go back into your readings, into your books, into your med-surg books. Right? There's a lot of topics on that HESI prep that are coming from your med-surg book or your med-surg class. Right? Does that make sense?
Yeah.
If you put some time into this HESI study guide and understand how to use your clinical judgment from the knowledge you have with each of these topics, you will ace the HESI. It's about patient-client scenarios. It's like your CJ Sims.
Okay.
It's as simple as that. I know it seems like a long assignment, but in the end, what I hear in week 12 when we do our debriefing is, oh, I don't know what I would have done without that HESI prep. So it is worthwhile. I mean, it's literally a preparation for the topics that are covered. It's not at all, it's very targeted. So if you don't think you need to fill out certain boxes, well, there's going to be a question about the boxes that are empty.
Yeah, no, all the boxes are filled out, just some of them.
Yeah, no, I'm
aren't,
just talking
like-
in general.
Oh,
I'm
okay.
just talking in general. If you do half of it, the other half that you haven't completed, you're still going to be asked about it. And
Well,
one of the
this
things
is-
we do in our
this is an
HESI reviews,
assignment.
pardon me?
Well, this is an assignment. We turn this in, right?
Yeah. It's worth 5% of your homework grade. Yeah. Yeah.
So if you don't fill out boxes, you'll get points taken off.
Sure.
Yes or no?
Yeah. Yes. There's a rubric that goes with it. Yeah.
But what she means is like, you're losing information if you don't fill it up. Also.
Well,
For the
exactly.
HESI.
That's like a double whammy. If you don't fill it out, you're not going to be prepared for your HESI. And the reason why you fill it out is to be prepared for your HESI, but then you get credit for it in your homework. Right?
That's why I was like, wait a minute, I thought we
Yeah.
had to do this. It wasn't
And the
like
other thing
just
the other thing we do in our HESI reviews, what I like to do, everybody pull out your HESI study guides. Let's figure out what kind of question, what might the question be about anthrax from a clinical standpoint? What might the question be about in the home setting? What are we looking for with a below the knee amputation? We go through these boxes and think about what kinds of clinical questions should we know or be asked. So we try and guess or formulate, right? But I can tell you that the questions aren't going to be, what is a below the knee amputation? What is anthrax? What is the definition of domestic violence? So it's going to be, how are you caring for a client with these things? That's what it's focused on. And I just hear this over and over again in week 12 when I debrief with my students. So, but I have rave reviews for this HESI review assignment about getting prepared for HESI. So anyway, I don't want to go over, I'm already over 5 minutes. So I sent a couple of messages to students in the chat if they wouldn't mind staying on after. I don't know if you've seen it or not. Anyway, I hope you guys have a fantastic weekend. So as far as your HESI prep, you should be able to complete the whole thing minus next week's content in week 9. We are 3 or 4 concepts away from being done with all the content from this class. Right?
I wasn't one of the people you said to stay after, but I did just message you because I wanted to stay after to ask you a question, but never mind.
You can stay on after.
Okay.
Yeah, stay on. I can do breakout rooms. Hope everybody has a good weekend. It was good to see everybody.
You as well.
And we'll see you next week.
Have a good night.
Okay, thanks.
Professor, the exam 3.
What?